I'm hoping that you can address the longing for birth centers and the reason why we don't have them. As a childbirth educator and a doula, I always run into these moms who would love to have a home birth, but just can't bring themselves to do it. And so they end up in the hospital even if they don't want to. And I think there's a large segment of the population that would love to have the opportunity of a nice in-between, which would be a birth center similar, I guess, to what Alberta has in Stony Plain and what I understand Quebec has.
Well, if somebody could give us money, then that would be a really good thing to start thinking about. I was asked that question actually yesterday, and by midwives that were interested in the concept of a birthing center. I do have a dream of maybe even just starting with a birth home. So maybe women who can't have a home birth because their home just isn't the right size, or there's not access, they're not close enough to a hospital for it to meet the criteria for safety. Maybe that there wouldn't be access for an ambulance easily into the home. So that would be one place to start. I'm not sure that the right place for those things to come actually is to come from the healthcare planners. I think that the women that are looking for that, or the childbirth educators or the doulas or the midwives that are supporting that's the right place for those requests to come. And we do, I think, have to be able to articulate why that would make sense. And I do think there's lots of reasons why it would make sense. So I think we need to start thinking about it. And when we started thinking and dreaming about it, then you take your dream and you start to concretely say, okay, what steps would it take us to achieve that? And I think that there's opportunities for us to do that in partnership. I think what we're trying to do in some of our hospitals is to try and create that sort of birth center feel within the context of a hospital. And that's why a number of places in the Lower Mainland have moved to single room maternity care. And I think that's one of the steps. And I do believe that we could also make further steps, and we could do so if we do it in partnership. So Saris and I have the privilege of working at the same hospital, and those are questions we're always asking ourselves, is how can we make this more like a home birth setting? How can we lower risk? How can we work together collectively as a team, nurses, physicians, and midwives, to make the birth experience in a hospital what women are longing for in their home?
I have a slightly different perspective. And I want to ask back what our responsibility is as childbirth educators and medical providers. My work is around, my research work is around attitudes, provider attitudes to home birth and low interventive care and maternity care. And where do we learn, those things? And it's relevant for our consumers as well. So in my research, it shows that exposure is the biggest factor, that anybody who has been at a home birth, and it doesn't matter if you're a doctor or a midwife or a nurse or a grandmother or a brother-in-law, if you've witnessed the kind of care that happens at a planned home birth or even before the birth in a midwifery appointment, your attitudes are significantly different than those who have not been exposed. And it's simple education exposure. If you have exposure in a clinical role, your attitudes seem to be more favorable towards planned home birth or home birth. A lot of people come into my office, they have no intention of having a home birth. They barely have come in the door and are looking for midwives. They've heard that there's women who will look after them and that we'll spend more time with them, and they're interested in the time. And there is a lot of evolution that happens during the course of pregnancy and in our conversations, which is confidence building. And so my answer would be a little different, that I don't know if we should spend a lot of time and energy on creating birth centers in a setting like Vancouver, where you have the best of both options already available. Yes, I would agree that in the Great North, where it's very difficult, and weather, or you're in a setting where there's weather or geographic obstacles to getting to a centralized care, where midwives or physicians have to travel long distances in opposite directions to care for the women, it makes sense to have a centralized area. But we should be driving our allocation resources, I think, from what makes sense from those perspectives, but not from the sense of fear that people feel. They're not quite confident. Really, a birth center is a home birth in the midwife's home. It's, you know, it's no different. We have the exact same equipment. It's the same criteria that you would qualify for home birth or get transferred out of a home birth or out of a birth center. A birth center in a hospital is a different thing. So if you're talking about a freestanding birth center, you shouldn't do anything in a freestanding birth center that you wouldn't do at home. And yet you still have to get up and go to that place, and then get up and leave that place after with a brand new baby. When we're telling women not even to go up and down stairs, and they have to pack everybody up, get the car seat, go down, get in the car, go home, get settled, figure out what works there for nursing. I mean, there's a lot that doesn't make sense with that. So my answer back is that we need, when people are asking for birth centers, we need to understand why. What is it about this idea of a birth center that feels safer? What is it that we're doing wrong to not let them feel safe in these two settings that we have available?
In the absence of a question, I did just want to make sure that everybody was aware that in Fraser Health, we do have midwives that practice at all of our hospitals in Fraser Health. So, and that number is actually growing. Not quite every month, but at least every few months we have a midwife join us. So I think we're close to 50 midwives, if not over 50 midwives in all of Fraser Health. So we do have quite a few.